experience too many times with monitors, right? And with the parameters. And one of the biggest things for me is like, okay, they just went through this traumatic event, and the best thing they can do is have rest. And I understand they need to come and monitor them, and make sure they're doing okay. But then we do have the instances where monitors go off. And so what I've learned over the course of time, and I think you just spoke to that, is it's okay to ask the nurse provider or whoever the provider is to explain what this is, right? What is this tracking? Why is this going off all the time? I've had the instances where, exactly like you said, they came in and said, "Oh, don't worry about it." And well, I am going to worry about it because I want to know why it's going off. And they said, well, and they said, well, okay, well, we've set the parameters for this point to this point, and actually they can be from here to here. So it's okay if we expand those a little bit. But they don't. I'm the customer, right? We're the customers. The patient is the customer, and it's okay to ask. It's okay to say, explain this to me, because if they're more, have more knowledge about it and more informed, I think that they're less afraid of asking questions. And while we're talking about asking questions, I've had some fantastic nurses. I mean, they've just,
yes.
It's just, I call them angels in the hospital. I mean, it's just unbelievable, and it's just great. And I've had some ones that haven't been the best, right? And they're just, it's almost like I'm there to do my job. I don't need to become friends with them. I want them to have good care. But, when you have to track them down, and I know they're overloaded in patients, but what do you do when you feel like the care you're getting is not to par, or you have to search them out, and maybe you want to just remind them that we're just not numbers, we're all people, and this is my family, or my son and daughter, grandfather. So how do you approach that with someone who's providing care?
I'm going to answer. I think I didn't answer well enough the first question, because you brought this up again, and I think it's so important that you have to ask the questions. You have to advocate, find the confidence, because if you don't ask or find out the information, it may result in harm, right? So that has to be part of your patient advocacy, whether it's for yourself or your family member. But I would say don't let it rest, meaning if you don't feel right about something, you have to take it up what we call the chain of command. So you start with your nurse. If you don't get resolution, or you don't feel good about the lack of action or the answer that you got, escalate it to, there's always a charge nurse. And then there's always a nurse manager on the unit during the daytime usually. There's always 24/7 a house supervisor. So they're a nursing supervisor that their tasks can be, moving a patient out of ICU to the med-surg floor to make room for a critical patient that's coming from the emergency department. But they're ultimately responsible. And then the final level that escalation should go to is the administrator on call. So there's always a hospital administrator 24/7. So if it's after business hours, there's always someone on call. The other thing I'll talk about is rapid response teams. So there is a lot of hospitals that have systems set up where if there's concern before a cardiac arrest, that the nurse should call to get help. So this team usually consists of a critical care nurse with a lot of experience and that has extended training. It could include the ER physician. It could include a respiratory therapist, sometimes a pharmacist. But if the rapid response team is called, they're supposed to come to the bedside immediately, and it is to prevent cardiac arrest. But we don't want it to get to that point. So when the family says, hey, something is wrong, like I said earlier, you know your family member better than anybody. We as healthcare providers and nurses should be listening. But if not, you've got to keep going with that. I talk about the first chapter, the story of Lewis Blackman, a 15-year-old, and his mother later said, I wished I'd have known who I could have escalated to, because she expressed concerns for several days and was never heard.
It's amazing. And there's so many questions here. Let's go first with the if there's a difference between a critical event that you don't plan for and one you don't plan for, right?
Yeah.
So let's talk about a couple of those, but let's, if I'm going for one that I'm planning, like a planned procedure or something, how do I learn what questions to ask, or what rights do I have?
So there is something called the Patient Bill of Rights, and it's every healthcare institution has to honor those patient bills of rights, and that is you have access to your medical record, you have the right to get care from a physician, you have a right to be respected. All of those things are kind of the baseline of what is a patient's rights, which, and if you're family, that includes you in that piece, right? So that's to start with. And then if you're going in, for example, surgery, we know that there's usually anesthesia given. We know that the patient needs IVs. We know the physician should be explaining what the surgery is supposed to be for, what the expected outcomes are, and then what the anticipated length of stay, after the surgery, what should be expected. So ask those so you can plan for sure. Ask, and I think this is really important too, if it's going to be a surgical situation, ask the physician, how many of these surgeries have you done? There is, in the literature and studies, a direct correlation of outcomes, positive outcomes or negative outcomes, based on how many surgeries that surgeon has performed. So while it's great to have a newer, younger physician because they've got the updated training, they don't have the experience, and so again, that should be a mentorship type relationship, which is why they have residency programs for physicians. But ask the questions: who's going to be doing the surgery, who's going to be supervising the surgery, and just make sure that you get answers that you're comfortable with. The other thing I'll say is go get a second opinion. If your surgeon or physician is a good one, they will support that. Say, absolutely, I may not know everything. Maybe there's a newer procedure out there that's less invasive or that would be better for your condition, but you've got to do your own research. And we're so blessed and fortunate to live in the information age where we can find a lot of information. Just make sure it's a credible site if you're going on the internet. But yeah.